Sybille Bergin is a physiotherapist specializing in neurological rehabilitation. Sybille and her family built Bergin Motion, a family-owned physiotherapy clinic in the Barrie area. Welcome to Underestimated.
Thank you.
So let's start with your family business, Bergin Motion. It's in its second generation. What drew you to physiotherapy?
That's a long story, and I'm going to try and keep it really short.
Mm-hmm.
I think more important is what drew me to work with people with spinal cord injuries,
Mm-hmm.
I think. It starts a long time back when I was working in Switzerland for 6 years, yeah. And I had an opportunity to learn a lot about aquatherapy and PNF and Bobath, and I took a number of courses. So that's when it started. And then I came to Canada, and I just simply continued getting to know more, educating myself more about spinal cord injuries. And it just developed into that slowly. So
Great.
It wasn't one day.
Yeah.
Yep.
How do you help people aging with a disability safely build physical activity into their routine?
So I think I start the process with everybody, and it doesn't really matter who that is, what kind of injury somebody comes to me with. I initially want to understand what is their current level of activity, and that could be, are they willing to go see their friends? Are they going to a gym? Or are they just simply staying at home a lot? Like this happened during the pandemic, right? So understanding what their level of activity is, and then I want to understand what their goals are. And their goals could be so different. I just worked with a fella this morning who wants to become a Paralympian, and that's not for everybody. Somebody else might want to do weight loss. Somebody else wants to get back to a gym. So it really is a very personal goal that we have to kind of explore together. And in order to do that, the first thing I really also need to do is to understand what their body structure looks like. Where are the limitations? Where are the abilities? How do they sit in their chair? Are there any kind of structural impairments that I have to pay attention to? So I'll look at their bone alignment, I'll look at their ability to move on a mat table, for example, which I call mobility, just being able to transfer, and how do you turn on your left, how do you turn on your right, and just really understand how do they move best. I might also look at what their heart rate is like, so, and then to be able to use that heart rate, right, to consider some exercise options, so looking at what their resting heart rate is, and then calculating what their target heart rate is, right? And then we'll talk about it, and just say, okay, these are the limitations, these are the abilities, and now let's find a way to how we're going to get you more active.
Yeah. So what would be some exercise options that address cardiovascular or heart health?
So, sorry for that. So I'll probably first go back to this whole mobility issue. Mobility meaning, getting from the chair, transferring to a surface, or getting on the floor, turning. Can you get on your hands and knees? Maybe can you lay on your belly? Lots of people can't, so we need to look at that. So that mobility in itself is a cardiovascular exercise, right? Getting into these positions. A very low-key type of activity, but it is a type of activity. We have weight training. We can do weight training. We can use free weights, and we can use pulleys. We can go swimming. That's another opportunity. We can use ropes. I don't know if you've seen these big long ropes that you can actually, right? And that's a huge.
Those are hard.
They're very hard, super hard, right?
Yeah.
But some people can do it and some people can't, right? I might look at cycling, some kind of cycling. Could be an arm cycle, could be what's called the motomet. I don't know if you're familiar with those.
Could you describe that in case?
Yeah, a motomet is a passive way to do a cycle. So the machine basically does the activity for you. If you can participate and push as well, the machine picks that up and actually allows you to add that little bit of extra that you can do. And the same thing for the arms, right?
Yeah, great.
Yeah, and wheeling outdoors. Let's just think about the outdoors and just say maybe just wheeling through the park is a physical activity.
So physical activity is a time commitment,
Yep.
which many of us don't always feel like investing. How do you help people with the motivation?
I think it comes from an understanding of what you need. I think it comes with education. So, and an understanding what you like to do, right? So, if I know that my body needs to stretch more, maybe that's where we go.
Okay.
If my body needs to be more, increase the heart rate, then that's where we go. And then we have to figure out what is it that you like. So many people come to me and say, I hate going to the gym. Okay, we don't have to go to the gym. So understanding what you need and understanding how you can do it, because there's so many ways of doing it. We don't have to be scared of gyms. We don't have to swim. We don't have to. We can do it in a different way, right? And then I believe the other piece that would be very motivating is when we can find an individual that will support us through this here. Is it the physio? Is it my mother? Is it my sister? Is it my PSW? Is it a trainer? Is it, it can be a friend. It could be anybody, right? So then we take that activity and say, let's just support it. If we decided that wheeling in the park is my physical activity that I'm going to do today, bring a friend. Go out, explore that particular park. How am I going to manage that hill? How am I going to manage the hill down? How many breaks do I need to take? And that's okay.
So that's a good segue. What should people watch out for?
They should watch out for a number of things. They should watch out for, first I think, the first piece, and I'll go back to the physio piece.
Okay.
Pick the right physio. Don't just go anywhere. Because if you go to a clinic or you go somewhere where they don't understand your condition, you're wasting your time. Just really find a physio that understands or has worked with somebody with a spinal cord injury. That is really, really important. And explore your wishes and explore your current activation pieces and go with that. Don't force something that your body doesn't want to do.
So listen to your body.
Listen to your body, find the right person, and get the supports that you need.
That's great.
Right?
Thank you, Sybille. Yeah. So how can our viewers learn more about what you do at Bergin Motion?
Well, you can go to our website, which is www.berginmotion.ca. Bergin spelled with an I, Bergin, just in case, because there are some people that spell it with an E. We are on the website. There is a lot of information on different conditions. There's quite a few blogs on it as well, and some information about ourselves. Yeah.
Thank you so much.
You're most welcome.
Thank you.
Pleasure.